The following is a production for RxTV. Some video may not be suitable for all ages.
Coming up today on RxTV, we hear from Dr. Graber on the latest in medical weight loss surgery. We stop in with Dr. Stephen Vale from Acuity Laser Eye and Vision Center, where our producer of RxTV gets LASIK vision correction. And we stop in to see our friends at LMN Custom Footwear to learn about a custom fit. All that and more on RxTV. If you're tired of glasses or contacts, LASIK surgery might be an option you might want to consider. We catch up with producer of RxTV, Jason Rogers, who has made his appointment with the recognized leader in LASIK surgery, Dr. Stephen Vale.
Jason, how are you feeling right now?
Pretty good. Pretty good.
You'll notice he's not nervous, and the reason he's not nervous, even though he's having laser vision correction, is that we gave him some medicine to relax him. So I think if it's okay with you, we'll get ready to go to the operating room. Jason, you've already experienced the consent process, and basically that went okay? No questions or any concerns left?
No questions at all. They covered everything.
And all your questions were answered prior to surgery?
Definitely.
Okay, great. Then at this point, I guess we should go to the operating room and have laser vision correction.
All right.
All right.
Can't wait to see.
Great. And it's slightly colder than out in the waiting area. And the reason for that is we have a controlled environmental system here. The other thing is when you look up to the ceiling, you see we have surgical tiles up there. Those are the kinds that don't drop particles down. Of course, that's very important because you don't want particles falling on your eye when you're having laser vision corrections. All right, so as Kathy said, we don't want you to talk under the laser. We just want you to just say mm-hmm or mm-mm. Because obviously we want the optics on the laser to stay dry, but the optics on the laser do have a shield on them to prevent them from being, spit on or from any kind of fluids to get on them. The great thing about laser vision correction is that, especially with LASIK, you get pretty immediate results. Your vision ought to be quite good tomorrow. This drape is to keep our surgical field clean. I'm going to adjust your head a little bit. You see the red light now, or do you still see just green?
Green.
All right, I'm going to move the red light towards you. Your eye's going to come into focus in my microscope. Now, I'm going to mark your cornea, and that cornea marking, chin up a little bit for me, allows me to mark our astigmatic axis as well. So what that does is we have to correct astigmatism, not just the power of the astigmatism, we have to correct it on the proper axis. If it doesn't get corrected on the proper axis, you're still going to have some astigmatism, which we don't want, obviously. So now things are going to go dark with the vacuum on. Is it a little dark?
Yeah, it's
okay.
very dark.
You're going to hear buzzing now. This buzzing sound is normal. Okay, try not to squeeze. It's very important you don't squeeze right now. That's it. Stay there. And you see that didn't take very long, and that was the flap cut. That's really probably the most complicated part of the laser vision correction, is cutting the flap. Raise your chin a little more. As you see, well, you can't see it, but if you looked at the TV screen, you could see the fixation light, but the lines on the laser reticle are matched up with the lines on your cornea, and that assures that the laser knows the axis to correct the astigmatism. Now, there was a little bit of bleeding here when we cut. That's not a significant issue. Just dry the blood and proceed with the laser vision correction. Now, your job is to look at that red light. You see things will get darker, and you'll see just your fixation light. Just look at the red light, and the laser will fire now. Stay on the red. Now, during the procedure, I'll intermittently stop because these lasers are photoablative. They remove tissue by basically destroying it and breaking the proteins down into carbon dioxide and water. Carbon dioxide will obviously evaporate and the water will accumulate. You have to dry it out of the way so it's not pooling there because it can affect the treatment. For those of you that are on TV watching, you can see that it only corrects in one axis, which is different than the original treatment. Now we're done. All we have to do now is put the flap back in place. We do that first. I irrigate the interface. And then I put the corneal flap that we cut initially back in place. Because you know people are really excited, and that's the great thing about doing laser vision correction is that people are really excited about this, especially the immediacy results when they see really well that day or the next day. They get very excited about that. And look to the left. I'm going to take the speculum out. That's a great thing for Kathy and myself too. We love that too. Close your eyes, please. We finished surgery on Jason's right eye. In a moment, we'll perform surgery on his left eye, and we'll be right back. Jason's been in the postoperative area relaxing here for about 45-50 minutes while we've been operating on some other people. How are you feeling, Jason?
Great.
Okay. We gave him some antibiotics, and now we'll have Jason sit up and come over and have a seat in the exam chair. We'll take a look at you. This is just a check to make sure your flap hasn't moved. Blink. And we also check to make sure there's not anything under the flap. Look down. You know, theoretically, as I said, there could be particles of material under the flap. We irrigate really well. Blink. Now that eye looks fantastic. Let me just have you open up a little wider. I know that you're a little light sensitive. We'll give you some sunglasses to wear at home. We also give you a kit, which includes a pair of goggles, so you can sleep in those so you won't inadvertently touch your eye while you're sleeping. And you wear those for the first week. You wear the sunglasses for several months. Look down a little bit. And the reason you do that, I'm going to check the other eye now. The reason you wear the sunglasses is the sunlight can have effects on healing, we've discovered over the years. So we ask people to take sunlight out of the equation by, look down again. Look straight. A little wider. That looks great. Jason, sit back. We have your host back in working order, and he'll be in tomorrow for his one-day post-op visit, and I'm planning on having him seeing better than 20/20 by then. Here at Acuity Laser Eye and Vision Center in Scranton, Pennsylvania, we offer the most advanced LASIK at affordable prices and have 2 laser vision correction systems to provide laser treatment to the widest range of possible corrections. I've been performing LASIK since 1994, and I'm the most advanced laser vision correction specialist in the Twin Tiers area. Our phone number is toll-free number 877-520-3937. That's 520-EYES.